Well, a stunning move by the American Cancer Society this week, telling women around the world to have their mammograms later, at the age of 45 instead of 40, and less often as they grow older. When it comes to cancer, is less really a good idea? Dr. Christine Risk is a breast cancer and surgical oncologist at Stony Brook University's Cancer Center. We thank you for your time today.
Thank you, Elisabeth.
What did you think when you heard about this new recommendation?
I think this is a really confusing and dangerous message that we're sending women and their healthcare providers. We have three different groups now saying three different things. We have the task force suggesting mammograms at 50. We have the American Cancer Society now suggesting mammograms at 45. And, of course, the American College of Obstetrics and Gynecologists recommending it at 40. So there are many mixed messages.
Yeah, and when you're looking at the numbers, I mean, the majority of the 230,000 breast cancers diagnosed annually are found at early stages, giving women a 90% survival chance. So I'm hearing all along in my lifetime, prevention is key to living your life. But now we're actually giving 5 years away in terms of prevention. This seems absurd to most women.
It's absolutely absurd, Elisabeth. Unfortunately, in this situation, we're sort of disempowering women and their rights as far as choosing for their health care. The new guidelines suggest that women should be given the opportunity to have mammograms from the age of 40 to 44. Unfortunately, that opportunity will not be up to women, but will fall on their insurance companies, which I think is the real fear and concern.
You actually compare this opportunity for women to evaluate and start learning about what procedures they should be having to you going out and replacing the tires on your car and picking the actual rubber.
That's exactly right. I know nothing about cars and tires, and so to ask me my opinion on what tire I would want is ludicrous. Similarly, we as healthcare professionals have to be giving advice and advising women, not sort of leaving it up to their whims or their insurance company's whims.
This is ultimately really bad news for women, in your opinion?
I think it's a dangerous message. It's a confusing message. And I think we really need to look at the details of this study. Once again, unfortunately, they looked at older data where digital films and 3D mammography were not in use. They looked at film mammogram, which is a very, very different entity than today's mammograms.
Dr. Christine Risk, we thank you for your time today.
Thank you, Elisabeth.